Research studies are the main reason why we have the knowledge we have at our fingertips. But what does it look like behind the scenes of these studies? In 1932, Tuskegee Institute, along with the Public Health Service, began a study called the Tuskegee Study of Untreated Syphilis in the Negro Male. This study wanted to observe how syphilis worked in black males so they may find a better treatment. However, things were not as they seemed. Not only did this study last for 40 years and not the 6 months as promised, but researchers never provided the guaranteed treatments to those that had syphilis. In addition, subjects were not informed of what the study was going to do, but said yes anyway. This is called uninformed consent. The study was conducted among a vulnerable or unprotected community of poor black families. But wait, the researchers found out helpful information towards their study, right? And in exchange for being in the study, the subjects were given free food, burial insurance, and medical exams, right? Doesn't that make up for all the pain and suffering? This question of risks versus benefits is called beneficence.
In fact, after the Tuskegee study, a document called the Belmont Report was created to address this issue of beneficence. It states that a research study should maximize possible benefits and minimize possible harms or risks to someone.
In research studies, a benefit is something good that comes out of the study, and a risk is a chance that harm or injury may happen. Risk can come in many different forms, like physical injury such as illness or a broken bone, mental or emotional trauma like PTSD, loss of money, and many others. In the Tuskegee study, there was a risk of life-threatening syphilis in the subjects because they were not getting the treatment that the researchers promised. Benefits usually occur for researchers, not the subjects. Many believe getting paid to participate in a research study is a benefit. This is not true, because this payment is considered a coercion or encouragement to partake in the study, not voluntarily. The most common benefit for researchers is simply finding interesting information through their study. This being said, one cannot put the benefit of knowledge over the risk of the study's subjects. This is where the balance of risks and benefits comes in. Finding an ethical balance of these two things will create positive beneficence. In other words, if the Tuskegee study had given the syphilis treatment they promised and provided enough information about the study while also collecting their data, it would have practiced positive beneficence. Benefits would have outweighed the risks.
Think of this. You are an ER doctor. An unconscious, non-responsive patient is rushed through your doors. He has no ID, no one with him, and no contact information. He is in critical condition. Usually, consent or voluntary permission to medically work on someone is required, but in this case, there will be no consent. Do you help the man without consent or let him suffer and die but follow the rules? Helping the man and letting him live would be considered a benefit, while breaking the ethical rule of consent would be a risk. Many would say that giving the man life would outweigh the risk of no consent. How would you use beneficence in this situation? This video was brought to you by Maddie Kelly, Alexis Harrison, Megan Levine, and Abby Jurens.